So pleasure to be here. My name is Erin O'Halloran. I'm the General Manager and Vice President for Oracle Health Canada. I started in that role 9 months ago, which if you pay attention to human gestation periods is the length of time for a pregnancy. I did not birth the new EMR that we just announced, but our company did. So that was timely on around the 9-month mark. I love the Infoway conference because it reminds me, who's been on the Flyover Canada ride? Anybody? Yeah. I love that because we get to hear from all the different provinces, all the different vendors, all of the people across the country that are working on the same hard things and trying to achieve the same important outcomes. I know we heard from Lee and his relentless focus on patient engagement in New Brunswick. We heard from Scott. Where's Scott? He promised me he'd be here if I gave him a shout out. There he is. Always bold, Scott, and advocating for the patient. We heard from Quinn. I don't know if Quinn's still here in Alberta. Obviously Ontario, we're in the nation's capital. I'm from Ontario originally, so I can say it is referred to as the center of the universe in every other province. And lots of great stories and lots of smart, dedicated people working on the same things. The Infoway conference is also always my most frustrating conference because I look at all that we still have to do. But what I want to ask everybody right now is I want you to think about something professionally in this realm of interoperability and digital health innovation. Close your eyes and think about something in the last year that you or your team achieved. And I want you to give yourself a round of applause. And now I want you to think about where you were, personally or professionally, 5 years ago, and what you were working on, or what Infoway was working on, or what your team was working on, and now look at how far we've come. I'm very guilty of feeling like we're not going fast enough, we're not going far enough, we still have so much to do. If we could just do X, Y, Z, let's just get it done. But I really do think it's important to pause and look at how far we've come. Grandma Karen yesterday talked about always keeping the patient and the person in our hearts and in our heads. Andrea, I am not going to cry. But I think that it's very important that you think about what your why is. And if you don't have a real good one, if you're not a super mission-driven person, that's okay. Takes all kinds. But talk to somebody else who has a really meaningful why about why they do what they do and why they work where they work and why they work on what they work on. I asked Andrea Tate if I could give her a shout out. If any of you, most of you know her, she's pretty legendary from Orion Health. If you don't follow her on LinkedIn, highly encourage it. She has been documenting her patient journey dealing with breast cancer diagnosis and her choice as a patient. These problems are not for other people. These problems affect our health, our parents, our children. This is very, very important work. And it is really all about the patient. I loved the hockey analogy. I'm a unabashed hockey mom. Quinn and I last night at dinner spent more time talking about hockey than anything else. And when I introduced Claire, I had the privilege and pleasure of talking to her beforehand. And I think that in that hockey analogy, patient data is the puck, right? And really good hockey players have really good puck control. And patients want to be empowered. They want control of their information to do with it what they choose. And really, really good hockey players skate to where the puck is going to be. Wayne Gretzky, if you're a diehard hockey fan or not, has a big philosophy on how he watched hockey and how he could predict where the puck was going to be. And that's ultimately where we want to go. At Oracle Health, the merging of Cerner with Oracle Health. We had a life sciences department at Oracle Health with clinical trials management system, who historically only ever worked with CROs and pharmaceutical companies. Well, now we can take that clinical trials management system and bring it into an EMR so that patients don't have to be at a big, important, fancy medical, academic medical center to enroll in clinical trials. We're trying to skate to where the puck is going and get that data so that patients can access better treatments, better care, and take more control of their health. So it's a pleasure and a privilege for me to introduce Claire Synman, who's going to talk a little bit more about the patient journey and patient advocacy. And I asked Claire, what matters the most to you? And if you had, I literally said, if you had a magic wand and time and money were no object, what would you do right now? What would you give people in this room? And she said, time. Time with the patients. Time with your family. Time is our most precious, non-renewable commodity. And all we're trying to do here is give patients and doctors more time. So Claire is an author, blogger, and advocate for patient and healthcare collaboration. She is remarkably passionate about inspiring people to put their health in their own hands. And as a result of her own lived experience as an individual with a brain tumor and other chronic health conditions, she'll share her journey today. She's a TEDx speaker and is always looking for ways to increase communication and collaboration between patients, families, caregivers, and the healthcare system to improve the patient experience, access to care, and embed an understanding of what matters most to people across healthcare. It's my pleasure to introduce Claire. Also from Vancouver.
Okay, everybody can hear me. Good afternoon, everybody. Before I kick off, I actually want to thank each and every one of you here today for your interest and your work in digital health, because health data and really why it matters is important. As a person with lived experience, those areas have tremendous impact to me. They impact my patient experience, they impact my quality and my safety of care, and it matters. So I just wanted to make sure that I took a moment to really thank each and every one of you. Now, I'm going to kick off, and I know that I am sort of the person in between you and your exit strategy to wherever you're heading off, and I know that we're going to do a bit of time travel here today. So, any of you like to time travel? Yeah, well, I'm sure some of you do. It might be maybe back to a time when things were easier, right? You might be younger, might have had a bit more hair, might have had a few less lines. Maybe it wasn't so much of the 9 to 5 or 9 to 9. Well, this is my younger brother and I. Many, many moons ago, in the 1800s, according to my teenage son, yes. Our parents often gave us jobs to do, right? To keep us out of their hair. Do any of you do that? I know I actually do that as a parent. Well, one was painting this long wooden fence that we had with water. Now, this photo always makes me smile, and I love to start off a talk with something that just sort of personalizes things, but I'm not sure that my brother knew that he would be headlining this talk. But anyway, here we are. Now, my accent, a bit about me. I am South African by birth, and I was very lucky to have grown up there until my husband and I decided to move to Australia. And we lived there for a couple of years and then moved to Vancouver, and we have called Canada home for over 19 years now. So a bit of global citizens we are. And so experiencing diverse cultures, food, weather, and sports was a big indoctrination for us, has really, and healthcare systems as well, has really sort of shaped my perspective on life as a person. But to start off, I'm going to tell you a story. I'm going to go back to my why in life. Now, let's time travel now. We're going to go back to 2010. Now, 2010 is the year that there was that Icelandic volcano that erupted over Europe. Any of you remember that? Yeah. It caused absolute mayhem with flights. And I remember this because, sorry, can you start the timer? Sorry, just asking for that because I need to keep an eye on where we are. I know that because my husband was actually stuck in Europe, so it was a big problem. And it actually was the year that the iPad debuted. And who knows, because we're actually here, I think, on my 7th generation iPad, so pretty amazing. But for us, 2010 was the year that life dramatically changed for us. In fact, there's almost a line that was drawn in the sand from before and after the 18th of May, 2010. And that was because I was diagnosed in the emergency room with a non-malignant brain tumor after the sudden onset of vertigo and migraines. Now, our son was only 4 years old. He was small. And what mattered to me in that exact moment was, would I get to see my son grow up? And would I actually get to grow old with my husband? I suddenly went from being a sort of a routine patient to someone who had multiple specialists, multiple appointments, and multiple medications. And my treatment plan was watch and wait. Now, that really means there was no surgery, no immediate treatment, but I was going to have yearly MRIs to monitor my tumor growth. Now, that was somewhat challenging to accept when you have something inside your head and there's nothing going to be done about it. But as John Kabat-Zinn says, he's a meditation guru, for any of you that might know him, he says you can't stop the waves, but you certainly can learn to surf them. Now, what mattered to me in that moment was surrounding myself with a strong medical team. I even got a second opinion, but also surrounding myself with my family and my friends. Over time, I did learn to surf those waves. Even with disagreements with some of the specialists on my care team, I had to learn to become my body's own advocate. And that was not easy in a system that is not really intrinsically set up around the patient. 2 years later, after my diagnosis, my brain tumor doubled in size. It caused my brain to swell, a condition called hydrocephalus. And unfortunately for me, my local safety net of quality and safe care disappeared. I experienced medical error, a terrifying experience. And without being my own advocate and being an activated patient, well, and having the support from my family and actually support groups and the doctors that I had at that particular point in time, I wouldn't be standing here in front of you today. My family were amazing. They helped me through that very critical point in my time. But what mattered most to me, while my brain swelled, my words started to jumble, my memory weakened, and my legs even started to go, was actually surviving to see another day. Now, when I finally arrived in the ICU, I met my neurosurgeon. This was just before my brain surgery, and there he is, in the top right-hand corner, Dr. Alfredo Quinones Hinojosa. They call him Dr. Q. And I remember meeting him, and he came over to me, and he says, Claire, he says, with a big smile on his face, he says, puts a warm hand on my shoulder. He says, I'm so happy to see you, he said. You are in the right place. He says, we're going to look after you. He said, and everybody here is going to make sure you are okay. His presence immediately calmed me. A reminder of how powerful human connection is in a largely impersonal environment. You know, I remember lying on that cold operating table under those bright lights. I feel like I'm under them right now. There were the nurses bustling around me. I was having monitors and cuffs strapped to my body. A chill of anxiety suddenly passed over me. You know, I hadn't actually felt scared about having brain surgery until that exact moment. My brain was too swollen to even care or even notice. What mattered to me then was actually human connection again. A nurse came to me and she wrapped this warm blanket over me. It was amazing. And she asked me if there was anything she could do to help me out. And I said to her, could someone please hold my hand as I go under? And she said to me, of course. She said, I will do that. And as you know, even 12 years later, this memory is very powerful to me personally, because that's how impactful it was. There's something very impactful about human connection when we are at our most vulnerable. She then said to me, she came and she held my hand, and she said, it's time now. And then I heard the anesthesiologist say to me, okay, let's do this. We're going to look after you. Count back for me. 5, 4, 3. You know, since that experience, every time I have surgery, which has been multiple times, I always ask somebody to hold my hand. It's the small gestures that really impact my patient experience, like Dr. Q coming to visit me at 5 a.m. after my surgery, or like the ICU nurse amazingly washing my hair after my brain surgery, or taking those first steps out of my ICU bed with a strong arm of the ICU nurse and the ICU staff cheering me on. During my 18-month recovery, as I was struggling with PTSD, I realized that safe and quality care were really what mattered most to me. I wanted my experience to really make a difference, and so I actually became a patient partner with my local healthcare authority. And this role showed me the importance and the power of the patient voice. And it gave me an opportunity to really contribute to improving the quality and the safety of care. But at the same time, I really had to learn as to how to accept a new normal. I was now living with a brain injury, an acquired injury from my hydrocephalus, from the brain surgery, and also from the aseptic meningitis that I'd had after my brain surgery. And so I had an invisible disability that I was living with. It affected my memory, how I processed things. I did have a 1.5-hour nap this morning, and that's how the brain works when you have a brain injury. I could no longer work full-time in my field, and so what mattered most to me was learning to find gratitude in the moment and learning to really connect with other people who were walking the same path as I was. And so for me, support groups and actually journaling became really vital in my everyday sort of work. And so what I did is I started journaling. And so I actually turned my then 30-page journal into a book. And you can see it up there, 2 steps forward. Embracing life with a brain tumor. And a couple of people have asked me on the bottom of my lanyard, it says 2 steps forward. And they've said, what does that mean? And I said, well, actually my mantra when I was recovering was actually, instead of, well, I'm taking 1 step forward, 2 steps backward, it was I'm taking 2 steps forward and maybe the odd 1 step backward. And that book actually opened amazing doors for me because I started to speak publicly and I met amazing people along the way. And I actually then turned sort of my passion for what I was doing into becoming a patient experience consultant. So that book has actually landed me here, ultimately, in speaking to you today. And now what matters to me is using my lived experience to help improve quality of care and improve the patient experience. And most importantly, based off my lived experience, is really advocate on how can we put our health in our own hands. The topic, really, that we're going to talk about today. And that was actually mentioned several times yesterday when we spoke about how can we help people be in more control of their own health and healthcare. So I'm going to actually read an excerpt from you from one of my other books, which is called Activate, How to Save Your Life in a Complex Healthcare System. When the sledgehammer of a health diagnosis hits, it can leave us reeling. And in that moment, no matter how prepared we are, common sense can go out the door. I know this feeling all too well. That day in the emergency room, those words, "You have a brain tumor," changed my life forever. I'm a manager by day. In my work, multitasking, planning, and ensuring I'm covering all aspects of a project is the way to success. However, all my manager instincts went out the window in the first 48 hours post-diagnosis. I was powerless, uncertain, and afraid. During my own patient journey, I quickly realized the importance of finding an approach to help me manage my healthcare. Our life was turned upside down following my brain tumor diagnosis. And the feelings of uncertainty, powerlessness, and fear were very, very real. There is something to be said for having a lifeline to keep you grounded. Mine was ensuring I was in control of my health. And this probably came from my training as a product manager. When uncertainty arises, make a plan. Well, this plan ended up saving my life. The reality, I think, is that with all of us living longer and with the increase in chronic diseases, every single one of us here in this room is going to be or may already be a patient, or somebody that we love or one of our friends is or is going to be a patient. And our healthcare systems, as we've already all discussed, are very complex and overburdened. Now, you may individually have very little interaction with the healthcare system, or you may have way more than you'd like to be having. You may feel 100% comfortable when you walk into the healthcare system, or it may leave you feeling completely powerless, afraid, and uncertain. So how do we learn to surf these waves of uncertainty? How do we turn the tide and really learn to feel more in charge? So I want everybody to take a pulse check. Not this one. We're going to take a different one, right? So this is what is called an active patient pulse check. So I'd love it if everybody could take a look at the screen and read through it and see what you think your baseline is. There's a scale here, and it actually shows 4 levels of patient activation. Now, I don't have any door prizes. I'm not going to ask you to share it around the table. This is just for you individually to have a look at. So I'll give you a few moments to have a look at it, and then we'll go from there. Hands up if you finished. Okay. Okay, so I'll just carry on, but if you haven't got your level yet, that's perfectly fine, because having a baseline gives everybody a starting point, right? And there's no wrong or right place to be on the scale. I started out at, I hope I'm pressing the right button here, let's see. Oh yeah, there we go, level 1. But I'm now probably around a level 4, but when I'm not well, I tend to regress back to a level 3. So what we're going to do and talk about today is how to put our health in our own hands. But first, I'm actually going to convince you that this is the right thing to be doing. So I do have a sales pitch for that. So we're going to go straight into that. Now, some of you may have already heard about the term patient activation. So what is it and why is it even important? And this is based off the information that I've actually learned over the years since my whole journey with the brain tumor, when I actually figured out why have I been doing this stuff and what is it all about. Now, patient activation is actually the knowledge, skills, and confidence that an individual has to manage their health and their health care. And it came from Judith Hibbard and her colleagues at the University of Oregon in 2004. Now, patient activation is dynamic, meaning it doesn't stay the same. It changes with many different things such as our environment and many other factors. But before we actually get into it, I just want to say it's not as easy as it sounds, because there's already this sort of existing power differential in the healthcare system, which makes it already harder for those of us receiving care to push against this power. There's many factors that influence patient activation. So for example, health literacy, income, age, education, cultural background, community resources, access to healthcare resources, and so many more things. So why does it actually even matter? Well, there's actually a lot of research on patient activation, and it actually shows us that activated patients have better clinical indicators, such as lower blood pressure. They also have better patient experiences with their healthcare teams. They tend to seek preventative care earlier and engage in healthier behaviors, and they sometimes stick to their treatment protocols, and they also have lower costs, meaning, for example, they might go to the ER less or have less hospital visits as well. They also have been shown that activating patients also helps achieve what the Institute for Healthcare Improvement talks about, the quintuple aim, right? So that's a better patient experience, better population health, lower costs, better care team well-being, and also better health equity. Now, I suppose from my side at least, this sounds like some good data on why we should be pushing both individually, but I suppose from a system perspective on why it's good to actually be an activated patient and why we should be looking to collaborate with our healthcare teams. But I think we need to be mindful on the environment in which we actually receive our care. Because as easy as this may sound, the environment we exist in can create sort of roadblocks, some speed bumps, some detours, and even some sort of stop signs. So what challenges do patients, families, and caregivers actually face, and how might that impact our ability to put our health in our own hands? So I'm going to just take you through an example over here. So this shows I call it my care chart, and it's really my healthcare teams and the places where I currently receive care. So over here, right in the bullseye, is my family physician, who I see every 3 to 4 weeks, and my pharmacy team. Top left-hand corner, I have 5 specialists. Top right, my imaging and life labs locations that I know very well. And along the bottom are a variety of allied health professionals who have supported me across my journeys, because I have a lot of different chronic diseases going on. So anyone from exercise therapists to clinical counseling, chiropractor, naturopath, RMTs, the whole shebang, right? But there's a few things that you don't see in this I'm very proud of my Canva diagram that I was able to create here. But there's a few things you don't see there that have made it more challenging for me personally to actually put my health in my own hands over the years, no matter how activated I am in my health and my health care. And I think some of these might resonate with you, whether you are a patient, you might be a caregiver, or actually working within the system. So one of those is the uncertainty and long wait times of new referrals, imaging, appointments, but really the lack of transparency around their progress. And then navigating a healthcare system that is not truly patient-centric, meaning it's not really designed with us in mind, but it's rather simply given to us. And then the burden of healthcare sort of managing your condition, whether it is going to all the different appointments, the imaging, the labs, and then actually the actual whole management of it, all the phone calls behind it and everything. Now that's a burden that comes for the patient, but also the people supporting them behind it. And then the fragmentation and silos behind different care areas, which is difficult to navigate not only for the person receiving care, myself as a patient, but actually for my healthcare teams as well. And then despite having universal health care, there's a lot of additional costs that come. And I think there's a figure that says on average per year, most patients sometimes pay up to $1,000 out of pocket. I know my pocket seems to be a lot deeper than that, that's for sure. And then we have the vast amount of data, what I call my patient story, which includes all my diagnoses, medications, treatments, appointments, and so forth, across the continuum of care, which is not readily available to myself nor my healthcare team. And all of these challenges make it hard to navigate the system and really to surf those waves of uncertainty, no matter if you are receiving care or if you're actually providing care as well. And so how do we shift to better care? How do we improve relationships with providers and take ownership of our well-being for ourselves, the system, and the population, if we really want to think big? And I think everybody plays a vital role in putting our health in our own hands, from being a patient, myself, to being a caregiver for a loved one or even a friend, and even people working in the healthcare system. That could be frontline workers, it could be clinicians, it could be health authorities, vendors, health information professionals, and policymakers as well. And I think together we really can create a system that supports individual and collective health. After my diagnosis, I had to think really fast, but in a simple and streamlined way, about how could I sort of advocate for myself and how could I put my health in my own hands. And so I did. I put my manager hat on and I figured out something that could help me sort of surf those waves of uncertainty and become more activated in my health and healthcare. I did not realize I was doing it at the time, but that is what I did. And that's what I'm going to share with you a bit about today. And for me, it actually helps me with those challenges that I just went over. But it is not a magic potion or a cure-all at all. I wish it was. But it is an approach that helps me feel sort of more in control. I think, as Luke reminded us yesterday, one of the things is, how do we put people in control? It helps me feel more in the driver's seat in a very complex and somewhat fractured system. So I'm going to show you what it is, and don't be blown away. I don't think I'm going to solve everything. But for me, simplicity is of the essence. So I call it the team approach. Track, educate, ask, and manage. It is super simple. But as you remember when I spoke about earlier, when an illness diagnosis hits, the simpler, the better. Now, the team approach can be used if you're an individual receiving care, or if you are somebody helping somebody who is receiving care. And if we actually think from a systems perspective as well, how might we support individuals receiving and providing care using a team approach? Now, before we dive into the team approach, I want to actually take a moment to acknowledge an important part of the team approach, and that is the support people, the support groups, and the healthcare teams. Now, support people are anybody who support patients in their journey. This could be anybody. Could be from a family member to a friend to a caregiver. It looks so different from everybody's situation. For me, it was and still is my husband, right? He knows everything about my health. He knows what meds I'm taking. He knows my medical history, sometimes better than I do because I have brain injury. He knows my symptoms. He is an integral part of my team. After my brain tumor diagnosis, crippling fear woke me up at 3 a.m., let me tell you. I went downstairs, I sat at my computer, and I researched many crevices of the internet. I found a Facebook brain tumor support group. This was 12 years ago. And that Facebook brain tumor support group has been a lifeline for me after my diagnosis, when I became acutely ill, after my brain surgery, and during my recovery. There is something so important about being able to connect with people who are walking the same path as you, even if you have an incredibly supportive family and friends. And of course, we have our healthcare teams, right, who walk alongside us from various different disciplines and areas, who are essential. So let's dive in. When my husband and I went for my first appointment with my neurosurgeon, he said to me, "Do you want a copy of your CT scan report?" I said to him, "Sure, okay." And he gave it to me. So I took it home and I read it, and I learned a lot. I put my report in a red binder. The next time I had an MRI, another brain scan, I asked for a copy of my report. I went home and I put it in my red binder. You see, I learned the importance of starting to track, right? Track my copies of test results. I was tracking my medical records, symptoms, medications, appointments or wait times for my appointments, all in one place. I was creating the story of my brain and I. And the more we take the opportunity to track our health, the more we will know the stories of our bodies. And we have to find these moments to track. Because until we have consistency across our healthcare systems of our health data and interoperability, as we're talking about, it is so important that we have our own bird's eye view of our medical profile. This will not only help us, but it'll help our healthcare teams as well. Now I'm going to talk about that red binder, right? The one place to store all that important information, the single source of truth. You may think it's old school, but since only 39% of people living in Canada have access to their personal health data online, old school it is. And there it is. There's my red binder. And since then, you can see my health data has grown. And that does not even include my GP health data. So that would be double the volume you see there. Being a non-routine patient can be a heavy lift at times. I live in Vancouver. I can access my labs online, which is rock star. Yet in 2024, even with our provincial health data portal, I am unable to access any of my clinical documents from my 5 specialists, very limited imaging reports, and no reports from my GP, who I actually consider to be my most responsible physician. However, as non-routine patients, we are often very, very creative. So I have created my own patient portal for my most important documents, because when I travel, there are certain things I need to be able to take with me. And why is this? Why would I do something like that? Because information is power, not only to those providing my care, but to those receiving care for me, right? Access to my health data, it gives me the knowledge, the skills, and the confidence to manage my health and my health care. It also helps me stay engaged. It helps me be prepared for my appointments when I go in, and it helps me build relationships with my care team. And thank you, Scott, from Nova Scotia. Where are you? I thought so. I really appreciated your sort of enthusiasm and sort of push for the patients having the access to their health data. I was really impressed with your comments yesterday, because access to my health data supports me with information across my continuum of care. You could see all the different places I was accessing care. Tracking also helps us catch mistakes, which do happen in a very complex system. Now, full disclosure, I don't have access to all of my patients' story. Some of it is still missing in action. And what I have obtained has been obtained through phone calls, asking, in-person visits, and even the fax. Now, this fragmentation is just an example, I think, of how that sort of lack of clarity at a public policy and governance level, as was actually articulated in a report I read over, data disarray from the Alberta Virtual Care Coordinating Body, has and still impacts me personally as a patient. So let's find those ways to track our personal stories. Now, in that 3 a.m. session I was talking about, not only did I look for other people who were experiencing the same issues I was, but I also started to educate myself about the fact that there was something in here that was not supposed to be there. So at my next appointment with my neurosurgeon, I was able to ask questions because of the information I had found, right? And so we had a more engaged conversation. I felt like I was more involved because I was more informed. Now, while Dr. Google has a great rating and is on call 24/7, the one thing to remember, the great thing about the internet is accessibility to data and information. The not so great thing about the internet is accessibility to data and information. I find that it can be overwhelming and downright scary at times. And so what I tend to do is I actually sometimes ask my healthcare team for advice on reliable and accurate information. And it could be a handout, could be a book, could be a website recommendation or a support group recommendation. And I think it's important to ask and actually find a way that works for you individually on finding that reliable and accurate information. We all learn, understand, and process information differently, right? Some of us want to know everything about our condition, And some people only want to know 20%. And that's okay, but at least know the 20% so you can get to the next step, which is asking questions. When I was diagnosed, I was told yearly MRIs were the medical standard of care, meaning that's the thing that most doctors did. And then my MRIs were discontinued when I was considered stable. And so I asked questions, and I got a second opinion who said to me, no, you absolutely need to continue your yearly MRIs. I'm glad I asked. But I find that asking questions about our health and health care is just not as easy as it seems. And so I tend to start with questions such as why? What if, and how can we do this together? And I often, before I go for an appointment, what I do is I actually do write out my top 5 questions, but then I make sure my top 3 are definitely things that I would like to get answered. And I also, when I go in there, I say to my doctor or whoever I'm seeing, I say, these are the things that I really would like to address. Can we make sure that there's time for them? This is still a work in progress for me, years and years later. Asking questions may sound super easy while we're all sitting here, but sometimes when we are squeezed into that 10-minute appointment, if we're lucky, the activation gets squeezed out of us. But I do remind myself, we are just people after all, and I'm curious and asking a question about my body. I keep a running list in my phone, because sometimes questions come to me while I'm cooking or going for a walk, so at least I know the next time I have an appointment, I can go back to my question list. Now, I think that some of us can probably agree that teams can become very effective through good management. And I think the same can be said for our health and our health care. And so I was thinking about this with my manager hat on. What do I want from my health care now and maybe medium term, long term? And I'll give you an example of this. For example, I was really struggling with my migraines. And I was like, I'm getting way too many of them. Where do I see myself in the next 3 months? And how do I want to get there? I was like, well, I need to speak to my neurologist about my medication plan. Is there anything else we can do? And so I want to speak to her about where I'm going to be in the next month, 2 months, 3 months, so I can really get this under control. I'm taking way too much of my one medication, and how can we manage this? And so I set my objectives in order to get to my goal. And so I think that's important about how do we think about our healthcare within a management mindset. But at the same time, when thinking about managing our health, it's also important to think about what actually matters to you. Not just only in health, but in life. Is it that you want to remain active with your kids? You want to travel, or maybe you want to make sure you absolutely go to play that tennis game once a week with your friends. I think as society, we need to shift more just from what is the matter with you to what matters to you. And this applies both to those receiving care and also those providing care. Now, I know this has been a long 2 days, and I know we're also a little bit over time, so I don't want to take too long. And I'm sure that there's a few people nodding off in the back. I'm joking. But I want to just wrap this out and make sure as we head out the door, we have a few things top of mind. So I am going to ask questions, and there are prizes this time. So there are 1, 2, I think about 2 mics, 3 mics there. But I'm going to ask a question, and first person to answer this one, first person to get the answer to this, put your hand up. What does TEAM stand for? Where's a hand? Come on. What does TEAM stand for? Okay, I see a hand. Do you want to come to the mic and answer? Okay, that was disappointing.
Phone a friend. Track, educate, ask, manage.
Fantastic. You get a prize. Well done. Okay, I'm not disheartened. I'm very happy. A team participant. No, thank you. Excellent. Okay, so track, educate, ask, manage. And it's easy to remember, right? Because I can tell you, I was actually a caregiver to my husband. I was in the emergency room with him, and I felt completely overwhelmed. And this was only 4 years ago. I didn't know what to do. Went outside and I had a coffee and I was like, what are we doing? I was like, oh, for goodness sake, you do this. You speak about this. I was like, track, go back in and ask for a copy, educate, go. And I was like, why did I not even think of that first time? So easy and simple to remember. Second question, are you ready? Okay, great. Name 2 other important groups that are critical to the team approach. Okay, I'll go for one important group that is critical to the team approach. Anyone? Yes, support groups. Thank you. You get a prize. Okay, it's not just support groups, right? It's support groups. It is support people, so families, caregivers, anybody who falls under the support role, and also our healthcare teams, right? So there is your last reminder. You can put that in the back of your head for any time that comes through. So where do we go to from here? When you leave today, you may be going on a flight, taking your car, driving home, taking public transit. Please consider the team approach. Maybe you're going to start tracking. Maybe you're going to think about getting a binder like me. Maybe you're going to figure out how are you going to get access to your health records online. How are you going to start tracking and building your patient story, or maybe somebody that you are caring for. Every step that you take, no matter how small, is a step that brings you closer to being activated in your health and healthcare. You can connect, you can communicate and collaborate better with your healthcare team. With my brain tumor, small mistakes led to a life-threatening situation. If I hadn't been activated, I wouldn't be here today. So share this message with your family, with your friends, with people that you meet. Your health is too important to take lightly. Let's take control, let's be proactive, and let's put our health in our own hands. You never know. You might save a life. It might be yours, or it might be someone you love. Thank you.